Welcome back. Are we currently seeing another COVID-19 surge? And what kind of impact does this have on our local hospitals? Dr. Douglas Casper, an infectious disease specialist with OSF Healthcare, joins us now with more. Good morning.
Hi, good morning.
Welcome in. Hopefully it's a bit warmer here than outdoors, but are we seeing a high activity level of COVID-19 right now in the Peoria area?
Yeah, we remain in a season of respiratory viral infections, and so we initially went through a peak of RSV infections, and then that was followed by influenza. Now we're seeing sustained COVID activity, and so they've kind of replaced each other with what we're seeing going through the community. But in the hospital, it's been a rise and fall of each, and right now it's predominantly COVID.
Wow. So I know there's been different variants, Delta and Omicron. So are the cases now more or less severe?
The case severity remains about the same. I think what's changed is that as we've progressed over time, we've moved away from most mitigation measures over the last year or so. And so we're just seeing more overall cases. And so the case severity hasn't increased necessarily, but everybody seems to know somebody that's had COVID within the last month or so. And so when you have more cases, you'll have more outcomes. And that's what we see at the hospitals. We tend to see more of the severe outcomes, but I wouldn't say it's any different overall than it's been in the last year.
Wow. And with that, how does that impact our hospital systems?
Yeah, the hospital system, which includes the outpatient setting, we don't talk enough about our prompt cares, our urgent cares, and our primary care clinics, is the main place where patients will start to seek care when they don't feel well at home. And so we're well aware of what mechanisms to go through for testing, for treatment, and for cases that exceed that capacity, the hospitals are very well set up. For each individual, though, you'd like to think that you'd prefer to not get sick. We'd prefer for people to not have to use those resources. And so that's where it comes in, where we still talk about the importance of vaccination and the importance of understanding when you may be at risk of becoming infected.
Wow. So for those who may feel like they're having symptoms, or just to prevent them overall, what would you advise?
Yeah, people seem to have a good sense of if they're going to be traveling or they're going to be around people, many other people where they don't know if they're sick or not, the ways to mitigate that, whether that's washing your hands, potentially masking. We're seeing a return of masking in the hospital setting, which has to do really with all three of the infections we talked about earlier. But really, vaccination is your best bet, and vaccination includes RSV, influenza, and COVID vaccines, and so it's not just one of them, but your best bet is defense before you become sick.
That makes sense, Dr. Casper. Well, thank you so much for all your advice. We'll be sure to follow up on our website, 25newsnow.com.
Thank you.